hi. Hi. Take a seat, make yourself comfortable. My name's Dr. Sarah. Pleased to meet you. Before we start today, I'd just like to confirm your details. If you could just tell me your name, please. That's fine. And your date of birth. Right. Your address. Okay, that's fine. And current contact telephone number. Alright. That's perfect. Okay, and what brings you here today? Yes, the cranial nerve exam. Okay. Have you had one of those before? Okay. Well, it's just a simple test to check the cranial nerves which supply the face and head. Okay, they connect to the brain and are involved in vision, muscle movement, sensory and hearing things. Okay. Good. So I'll run through different little tests to test each cranial nerve as we go through. Okay. Alright, so are you feeling well at the moment? Have you been well for a while? Good. And you've got no real problems, okay, that have made you want to have this exam. It's just something you like to have done now and again. Okay, that's fine. I'm happy with that. Okay, so are you sitting comfortably? Good, good. Well, before we start the actual cranial nerve exam, I just always like to check the temperature of my patients just to make sure that they are okay. Okay, so that there's no underlying infections that can affect any results. Okay, so I'm just going to pop this by your ear, and it won't go into your ear, but it will just take your temperature. You'll hear some beeping, okay? So you should just keep yourself very still. All right. It doesn't take long. There we go. You're absolutely fine. 37. Perfect. So that's good. So for the first part of the cranial nerve exam, I want to check your olfactory nerve. Okay, and this has to do with the function of the sense of smell. Okay, have you had any problems with your sense of smell or taste? No? Okay. Well, firstly, can you just pop your finger over one nostril? Okay, push it in and breathe up. So, okay, and can you do with the other side? So block this nostril and nice breath in for me. Okay, that's fine. And you've got no pain or pressure around the sinus area. Okay. And you've been well, so you've not had a recent cold. That all sounded very clear anyway. All right. So to test your sense of smell, I'd like you to just close your eyes, okay? And close one nostril for me, and I'm going to pop something under your nose, and I want you to tell me, this is just a solution, I just want you to tell me what you can smell, okay? Okay, so close your eyes and close one nostril for me. That's great, okay. So, tell me what you can smell. That's perfect. Okay. That was lemon. And can you block the other nostril instead now? Keep those eyes closed. Okay, lovely. And tell me what you can smell now. Okay. Yep, that's fine. was cinnamon. That's perfect. And the next one, just leave both nostrils clear now. And I'd like you to tell me what you can smell now. Coffee. That's perfect, well done. So you have no problems there with the olfactory nerve. Okay, that's all good. Now, the next part of the exam, I'm going to be checking the eyes, okay? So there'll be a few things that I'll be doing. I'll be getting you to follow a light. I'll be looking closely in your eyes, okay? And checking your blind spot and your peripheral vision, and also a little vision test. Okay? Right. Firstly, I'm going to just get you to look straight at my nose, alright? Don't follow the light. Okay, I'm just going to flick the light across there. Just checking your pupillary reaction. Okay, that's really good. And well done. Okay, and again, just keep looking at my nose. Okay. All right. Well done. Okay. There's no problem with that. Okay, that particular part. Okay. So, for this part, if it's okay with you, I'm just going to come in very close, okay, and just have a look at the fundus, the back of the eye, okay, so I can look at the vessels and also the optic disc there, okay, so you're okay for me to come in close. All right, okay, so you'll see this light. Okay, I'm just going to come in close. Could you look up for me and down to the left and to the right? Okay, that's great. You okay there? Super. And again on this side, it's coming close to you. Okay. So let's just have a look. Can you look up for me? Can you look down to the left and to the right? Okay, wonderful. Just give those eyes a little break for a second. Just jot some notes down. Okay. Okay. Right. What colour is this pen? Okay, that's fine. Can you cover your left eye and look at that again? Okay, and now can you take your hand off your left eye and cover your right eye? Okay, Does the red look the same through each eye? Perfect. Okay, so now I'm just going to check your blind spot. So can you pop your hand over your left eye for me? That's fabulous. Okay, and I want you to tell me when you can't see the pen anymore and then when it reappears. Okay, so you can see that there. Okay, I'm just going to move it up and down and from side to side. Okay, so tell me when you can no longer see it and when it's back into view. No longer see it and when it's back into view. Okay, that's great. And do the same but from side to side. Okay, fabulous. Now can you cover your right eye for me? And we'll do the same again. Tell me when the pen disappears and then when it comes back into view. You can see that okay. Good. Okay. Okay. You're doing great there. Okay. And from side to side, tell me when you can no longer see it and then when it comes back. Brilliant. Okay. Perfect. No problem there. Okay. I'd just like you to look straight ahead now, alright? And tell me when you can see my finger. Okay, can you see it wiggling? Okay, so can you see it? Tell me when you can't see it. Brilliant. Okay, tell me when you can see it. Okay, and again. Okay, this is making you giggle. Okay, and again. Okay, tell me when you can see it. When it's gone, okay, and can you see my finger? Yeah. Okay, and again on your left side. Okay, that's wonderful. Okay, and can you just quickly follow my finger? Okay, so don't focus on my nose this time, just follow the finger. Just check how those ocular muscles are working. Okay. Okay, and can you look up for me? Okay, and down, and look to your left, and to your right. Okay, fabulous. Okay. This time, I'd like you to follow my light, okay? So again, don't focus on my nose. Actually, follow the light. Don't move your head. Keep your head perfectly still and just follow. I'll be moving up, down and diagonally. Okay, starting from there, okay, to your right, to your left, okay. Okay. Okay, keep following the light for me. That's perfect. Thank you. Okay, so now I'd just like you to close your eyes, and I'm going to hold your eyes closed, and I want you to try and open them. Okay, so close your eyes for me. Okay, there we go. Try and open them now. Okay. Okay, I'm now going to try and force your eyelids open, but don't let me open them. Okay. Fabulous. That's perfect. Okay, so in my pocket I have a little Snellen chart, and I'd just like you to read a few things off here. Okay, so can you read the top letter there? Yeah. Okay, and can you read this line here? Yeah. Can you read that there? Okay. Now can you cover your left eye for me? And can you do the same? Can you read that there for me? Okay. Can you read that line there for me? And can you try there? Okay. Okay, so now can you cover your right eye for me instead? Perfect. And we'll try that again. Can you read that line there for me? And that line there? Perfect. And that line there? Fabulous. So you've passed that part with flying colours. Okay. Now I just want to check a few little bits of your facial nerve. Okay, so can you give me a big frown? Okay, that's good. Can you give me a big smile? Fabulous. Okay. Can you puff out your cheeks for me? And again. Okay, and now puff them out and don't let me push them in. Okay, that's perfect. Can you push out one side? Okay, and don't let me push that in. Okay, and can you push out this side? And don't let me push that in. That's great. Another frown for me. Okay, and raise your eyebrows really high. Okay, that's fine. Okay. All right. So I'm just going to pop my hands either side of your jaw, and I just want you to open and close the jaw for me. Okay, so open wide, close, and again. Okay, that's fine. Okay, so open nice and wide your mouth. Okay, wiggle your jaw from side to side. Okay, and while we've got your mouth open there, just a little bit wider and say ah for me. There we go. Okay, can you pop your tongue to the roof of your mouth? Okay, and to the bottom of your mouth. Lovely. And can you move to the left and to the right? Okay, stick your tongue out for me. Give it a wiggle. Okay, alright, that's fine. Okay. Now, have you had any problems with eating or drinking at all? When you swallow your food, everything seems to be going down fine. That's good. Nothing sticking, nothing feeling too dry. Good. Okay, so I'd just like you to take a little sip of this water and swallow it for me. And let me just watch that swallow reflex there. Okay, there we go. Doesn't have to be a huge sip, but and swallow for me. That's great. Well done. Sure, if you're thirsty, you can have some more. There we go. All right. There we go. So let me just make some notes on that. Okay, so are you feeling all right at the moment? Good, okay. So the next part of the exam, I'm going to be checking the trigeminal nerves and the sensory parts of your face, okay, to see how you can feel things on your forehead, jawline, cheeks. Okay, great. Okay, now for this part, I'm going to use a little cotton wool ball, okay, and I'm just going to gently touch and brush parts of your face, and I'd like you to tell me if you can feel it okay. Alright, so just close your eyes for me 1 second. Can you feel it? Yep. Can you feel that? Okay. And can you feel that? And that? Okay. So I'm just going to brush. Can you feel that? Alright. And can you feel this? Can you feel that? Okay. Can you feel that? Can you feel this? Okay. This. Alright. And okay, there. And just going to brush the top of one of your arms. Which arm am I brushing? Okay, that's perfect. Now, could you tell me, did the sensation feel the same on both sides, or could you feel it more on one side or the other? Perfect. Okay, so now we've done gentle touch. I'm now going to see how your sensation of sharpness, okay, is doing. This isn't super sharp, okay, it looks quite scary, but it's not. Let me just prove that to you. Yeah, okay, but obviously it's not as soft as the cotton wool ball. So again, I'm just going to touch different parts of your face, and I want you to tell me when you can feel it, okay, and then afterwards I'll ask you if you could feel it on one side more than the other. Okay, so there, yeah, can you feel that? And that, and that, okay, that, okay, that, okay, and I'm just going to dot one of your arms with this. Which arm am I dotting? Yeah, that's perfect. Okay, lovely. Now, could you feel that on one side more than the other, or did it both feel the same? Super. Okay. Full marks for you so far. Okay. Now, there's a little couple of tests I'd like to do with this. Don't worry, it doesn't hurt, okay? And this is the tuning fork, which I'm going to be popping onto the centre of your head, okay? And I want you to tell me if you can hear the sound and if it sounds equal on both sides, okay? So, there we go. Pop that up there. Can you hear that? Good. Can you hear it equally on both sides? Good. Okay. I'm going to be placing the tuning fork onto the bone just behind your ear. Okay, and I want you to tell me when you can't hear the sound of the tuning fork anymore. And then I'm going to move the tuning fork round to in front of your ear. Yeah, and I want you to tell me if you can hear it again. Okay? Alright. Okay, so just behind the ear there. And tell me when you can't hear it anymore. Okay, and going to move it just to the side of your ear. Lovely. Okay, and do the same on your left side. Okay, so I'm going to pop it behind the ear, then in front. Okay, you ready? Good. Okay, so pop that behind your ear. Tell me when you can't hear it anymore. Perfect. And then just going to pop it next to your ear. That's fabulous. Okay. Perfect. Well done. So, what I'd like you to do is just pop your hand over one ear. Okay. And I'm just going to whisper a number in the other ear. I'd like you to tell me what I've whispered. Okay? Alright. 99. Yeah, that's great. And do the same. Can you put your hand over the other ear and I'll whisper. Okay. Perfect. 72. Wonderful. Right, so you're checking out wonderful, and there's just one last little check I'd like to do for the accessory nerve, and I'd just like you to shrug your shoulders for me, like that. Okay, I'll put my hand on your shoulders, and can you try and push up now? Okay, perfect, that's super. Okay, and can you turn your head to your left? Okay, I'm going to pop my hand on your face there. I'm going to try and hold your face. You try and push my hand away. Okay, lovely. And can you turn your head to your right? And again, I'm just going to pop my hand on there and see if you can push your head back against my hand. Okay, that's perfect. Thank you. Okay. Right. Well, you'll be pleased to know that you have checked out absolutely perfectly on the cranial nerve exam today. Okay, I found no problems whatsoever. Everything seems to be functioning wonderfully. Okay, of course, you're welcome to come back and have another check in 12 months' time or before if you think you're getting some problems. Okay, but everything's fine and your vision seemed fine, so I don't need to refer you on, okay, to the ophthalmologist because you read the Snellen chart perfectly fine for what we need for this exam anyway. Yeah. All right. Okay, well, that's all for today and enjoy the rest of your day, and no doubt I'll see you at some point in the future for your next cranial nerve exam. Okay, take care now.